Bruce, you must have something really good too.
Of course I do. It's Bruce Danielson, and I guess I'm here to entertain you too.
I always forget. Well, good afternoon, everybody. Welcome to those here and those at home watching to the Tuesday, March 24th informational meeting. I'll get the meeting rolling, call the meeting to order, and start with any city council open discussion. And I would tell those at home and watching, we do have at least two, and I think I heard all three councilors not in attendance. They are attending on over the phone. So anybody have anything? Councilor Staley?
Thank you, Mr. Chair. In this very difficult time of constantly changing information, I wanted to throw something out that I'm considering, and so I don't want, this isn't in the form, it's not in a draft form yet. And perhaps the mayor's office would be so kind as to look at this, but just so the citizens know that the helpline center has, with the focus of the One Sioux Falls Fund, is providing funds to help avoid evictions and foreclosures, which is wonderful. And our city of Sioux Falls has also suspended utility disconnections for residential accounts. And so what I would like us to look at, and I know right now we're in the midst of determining what our city status is going to be as far as closing non-essential businesses. But what I'd like to propose is that we look at some type of legislation that would suspend or waive up to 100% of a monthly utility bill for any citizen or business who endures a layoff, job loss, or business foreclosure caused by the COVID-19. So just kind of throwing that around, and I would be delighted to get feedback from my colleagues as to their feelings about having something that would help citizens with this utility bill, sewer and water that is a fixed expense that they have that comes from the city. So, thank you.
Thank you, Councilor. Councilor Starr.
Thank you, Mr. Chair. I guess I would jump in with Councilor Staley. I think it's a great idea. It's something that we need to take a look at. It's one thing to get your rent paid, but if your water and electricity and sewer are disconnected, or you've got such a large bill hanging over your head to stay in your, to be able to shelter in place. So I'd enjoy seeing the next round or the next draft of that proposal, and it's, you know, something we could take a look at.
And just to follow up, the city of Sioux Falls has suspended utility disconnections for residential accounts. Now, that's residential. It doesn't say anything about business accounts on that. So I'm getting the sense the city isn't going to be shutting anyone's water and sewer off, but we're talking going even a little farther than that as far as the expense of just that monthly usage.
Councilor Erickson.
Just to add a little feedback on that. I think that it certainly merits additional conversations about it, whether it be forgiveness for the utility or really a loan process of saying, look, we understand you're in a hardship. We're going to extend this without penalties and allow you to continue paying at X amount, whatever it is. I'm just speaking as this is the first time I've heard this, but I think that there's more than one way to do it, and I think it certainly merits additional dialogue on it.
Okay. Anybody else? Anybody on the line have anything for open discussion?
Can I say one more thing?
Go ahead.
And now I don't want this, and you can stop me if I'm going on in the wrong direction, okay? But I just wanted to, and I sent an email out last night, but I wanted to say that I'm so grateful that this council and the mayor bonded together to talk to the Secretary of State and the governor's office about the election that's going to be happening in about 6 days. In 6 days, we're going to be asking people to go to a facility to start absentee voting. And I brought it up today at the Board of Health. that we need to make a statement to our citizens, if we're moving forward with this, that we want to assure them that they can come out with the greatest confidence that we're going to be keeping them safe as they cast their vote in this election that will be happening in the next 3 weeks. If the whatever the powers that be make a decision to change it to June, then that's a different story. But right now, just for the record, it's sounding like the Secretary of State says it's not their responsibility, the governor is saying it's not her responsibility, our mayor and city council, we have no authority, and the legislature is saying it's not their authority either. So we could be thrust into this situation the next 3 weeks where we're encouraging people to go out at the same time telling people not to go out. So it's a double message that it's a very difficult situation. So I appreciate this, Councilor Selberg. You signed the letter. Thank you for doing that. And see what happens.
Yeah, we will see how it plays out for sure. Thank you, Councilor. Anybody else? Councilor Erickson.
Just on that subject, I've been in great length of conversations with the Secretary of State, Steve Barnett, on this topic. Did receive a text message from him last evening saying that they had been in conversations with the governor's office on their thoughts about postponing the April 14th election. It will take legislation veto day, which is next Monday, March 30th, which in and of itself with social distancing provides a lot more challenges, whether they can meet virtually on the telephone or however they choose to do that. We thought we had a different way figured out. Unfortunately, this is the way that it could be. So I'd encourage everyone, if you feel that way, lobby your legislators and ask them for that support. So thank you.
Thank you. Okay, with that, I think we'll move into the presentation. I believe we have Director Franken here with a COVID-19 update. Welcome.
Good afternoon. Jill Franken, Public Health Director with the City of Sioux Falls. Thank you so much for arranging your schedules to meet with us this afternoon. We have a number of reports and status updates that we'd like to provide to you as City Council. And so we'll be starting with a situational update, and that will be with Sandy Frentz, as well as then a health systems update with two representatives from both Sanford and Avera. I'm going to just say, for the interests of the two gentlemen from Sanford and Avera that are here, when those folks get done presenting to you, if you have any questions, maybe ask them at that time so they can go ahead and head back to their important work that they're doing in this regard. So I'm going to have Sandy come up and get us started.
Welcome, Sandy.
Good afternoon, Council. Sandy Frentz, Public Health Manager with the Health Department. So I'll start with a little bit of a nationwide overview. So nationally, case counts of COVID-19 continue to rise. As of March 23rd, the Centers for Disease Control and Prevention reported 44,183 cases of COVID-19 with 544 affiliated deaths. Cases have been confirmed in all 50 states, as well as the District of Columbia, Puerto Rico, Guam, and the U.S. Virgin Islands. 479 of the identified cases have been identified as being travel-related. 569 cases have been contributed to person-to-person spread. The source of the remaining 43,135 cases is still under investigation. Looking more inwardly towards the state of South Dakota, we've had 30 confirmed cases of COVID-19 within our state. 5 of the confirmed cases reside in Minnehaha County, so that accounts for 16.7% of the cases. 7 of the confirmed cases live within the Sioux Falls MSA, so accounting for 23.3% of the cases. Looking at the age distribution, 36.6% of the confirmed cases are in people under the age of 40. 50% of the cases are in people under the age of 50. Looking at the breakdown by gender, 19 of the cases, or 63% of the cases, have been identified in men. 11% of the cases, or 11 cases, 30% of the 7% of the cases have been identified in female population. County of residence for the confirmed cases includes Beetle, Bonhomme, Brown, Brookings, Charles Mix, Coddington, Davison, Hughes, Lyman, McCook, Minnehaha, and Pennington County. Confirmed community spread has been identified in Beetle County at a substantial level, and then in Hughes, Lyman, and McCook County at a minimal to moderate level of spread. As has been reported on the State Department of Health website, which is covid.sd.gov, there has been one death affiliated with this outbreak. 790 samples have tested negative for the presence of the virus. 268 test results are still pending at the South Dakota Public Health Lab. And then just as a reference for case counts reported in our neighboring states, Minnesota has reported 262 cases, Iowa has reported 105, North Dakota has reported 32, Montana 37, Wyoming 26, and Nebraska has reported 52 cases. So with that, I would like to introduce Dr. Mike Elliott. He is the Chief Medical Officer at Avera McKinnon.
Thank you. Welcome.
Thank you. Good afternoon. Let me start by saying, as a representative of Avera McKinnon, Avera is a very proud partner of the City of Sioux Falls. We fully support what the City of Sioux Falls is doing, the precautions that they're taking to slow the community spread of this virus. We at Avera, we're laser focused on our efforts right now. Our intent is to be ready. We have built and continue to build our surge capacity. We are doing everything we can to conserve masks, gowns, gloves, personal protective equipment, because we can certainly see the future and anticipate that there could be a shortage. We have been able to develop in-house testing, which shortens the turnaround time from sample collection to test results significantly compared to where we were at last week. These tests will be focused primarily on our hospitalized patients because the fast results are necessary in order to not only help protect patients and families, but our staff and reduce our use of personal protective equipment. We are utilizing to the fullest extent of our capacity all of our e-care, our virtual care options to provide care to patients. We have stopped all elective surgeries and are limiting clinic visits. Again, the intent of that is to, again, both maximize our ability to handle a surge and to reduce personal protective equipment use. Avera wants to stress the ongoing and increasing need for social distancing. We can't employ folks strong enough to avoid crowds, to maintain that 6 feet of distance. We want to encourage anyone who is even mildly symptomatic to please stay home. Do not spread this illness. If you do have symptoms severe enough that you need medical attention, we would please ask that you call our clinic or emergency department before arriving. That gives us the opportunity to prepare to make sure that healthcare workers aren't unnecessarily or unknowingly exposed to this. If we can keep our healthcare workers healthy, that just means we've got more capacity to take care of patients. Avera as a system has started a no visitor policy. There certainly has to be exceptions to a policy like that. Beginning of life, end of life, certain cases in pediatrics, we have to allow visitors, we just have to. But the more we can limit visitors into and out of our hospital, again, that's part of our efforts to decrease the community spread of this virus. All of those efforts are intended to do one thing, and that's flatten this curve. If we get a huge surge of patients all at one time, it can overwhelm any system. So the more we can do to slow this spread, the better off we're going to be. You know, it's a tremendous honor to provide health care to people, to be part of a healthcare system, one that strives to deliver top quality health care to the people in this region. And along with our partners at Sanford Health, and of course, the folks here in the city of Sioux Falls, we are dedicated, strongly dedicated to doing exactly that, providing top quality health care into, through, and beyond this pandemic. I will turn it over to my colleague at Sanford, Dr. Mike Wilde, and then happy to answer questions after that. Thanks.
Thank you. Well, welcome.
Thank you. Thank you, Dr. Elliott. And so I'm Mike Wilde. I'm the medical officer at Sanford. I will not reiterate a lot of the words of Dr. Elliott, as I couldn't agree more with his comments. We also at Sanford would like to stress the message of really personal responsibility in these times. I would note that in our community, we have seen market changes in regard to social norms, in regard to cohabiting, in regard to social distancing, hygiene. You see more people out and about in spite of some usual weather challenges. But I think there's been an amazing response from the community. I think there's still some opportunities that exist. This is a new illness that was recognized in China late last year, thus the name of the illness in COVID-19. We've been in planning as an organization since January. We're always in surge planning. That is part of our ever readiness as a responsible resource and facility within this community. As we have ramped up our response, we have followed CDC guidance, and we have worked with local, state, and federal resources in regarding how we can best care for those that come through our doors. I would applaud the city in flattening the curve to this point, but as Dr. Elliott points out, the future is unknown, and we see what's going on nationally and internationally, and we hope to have a continuation of a flat curve, and that is a compliment to the people of this region, but also know that it's call to action to continue in those habits. We stand ready as a resource within this community. We're proud members of this community. Our doors are open. Our staff is ready to care for those that seek our expertise, and look forward to hopefully someday when this ends. With that, I would open it up to questions along with Dr. Elliott as well.
Okay. Councilors? Councilor Staley?
Both of you maybe can help. Okay, I've got a few questions.
We'll distance, so we don't want to make it awkward.
Excellent. So one thing for clarification, when we're hearing about these new cases, is there any way of identifying the severity of those? Because we could have someone who's just a little symptomatic who happens to be tested, right? Or you could have someone who, as we've heard about a legislator who was brought to Sioux Falls today from Huron, we have something really severe. Do we have a way of reporting that? Or can you tell us like a percentage?
I missed the very first, there was a word there I missed, and I'm sorry, I couldn't quite hear it.
Well, what I'm wanting to know is if we can let our citizens know when we're talking now about 20, I believe like 28 cases that have been identified in Minnehaha County, or is that in the state? Okay, in the state. And so Minnehaha, we have like 5?
Correct.
So when we talk about that, is there a way of separating the intensity of the illness? Are these like deathbed type of things, or are they just people who've felt a little symptomatic and?
Right. I defer the public to the state website. We really can't release any sort of severity information just based on federal law, and so we try to be as transparent as possible. And I can certainly state that we are caring for some patients. But from there, I can't really give specific information.
So we can never find out how many people have been hospitalized as a result?
Not a number, no.
Unless the family lets that, okay. Then, second thing on, then I'll pass it for now. How effective are masks and/or scarves? You know, if people are going out, I've noticed that, I've seen people, they're all wrapped up. So you would think to me, it would be like, is this a real great preventative type of a step?
So as I alluded to, we are following CDC guidance. CDC guidance is for healthy members of the public not to mask. And so that is our recommendation as well, is not to mask. To answer your question in regard to effectiveness, we don't know with this illness, only because of how new it is on Earth. You could certainly, it's a similar illness to SARS or MERS, which were present in the early 2000s to 2010, that range. And the masking did tend to be effective in regard to preventing transmission between people.
Are your doctors putting masks on when they're meeting with patients?
They're putting masks on when they're meeting with patients who have suspicious symptoms.
Even though the doctors are healthy?
Correct.
Okay.
Counselor Neitzer?
In terms of the tests that you can do now, I'm assuming I know we've heard from discussions at the presidential level, all these things about possibly new tests, but right now I assume it's a nasal test, an insertion, and a swab. From the time that you take that, how long is the turnaround time, do we know yet, for you to have results in your hand? And that's not counting possibly reporting to Department of Health, but just your turnaround time internally?
Sure. You're going to hear some variation in answers. The State Health Department might have one turnaround time. Mayo Clinic might have another turnaround time. Our current internal test, we believe it'll be about 8 hours from sample collection to report given to the physician. The test itself doesn't take that long to run, but you've got to get the sample that you've collected to the lab. You've got to run the test. You've got to enter the results. You've got to get the results back to the physician. We think that total time is going to be roughly 8 hours.
Is it correct that you were mandated to report positive results to the Department of Health?
That is correct.
But not negative?
We are not, to my knowledge, at this point in time, we are not mandated to report negative tests, but we are definitely reporting positive ones.
Do you have an ample supply of whatever it takes to do these tests, and do you expect that to continue?
We have been on the lookout for the last couple of weeks for how do we get more of just about everything we use in healthcare. Test kits, the swabs that we use to collect the samples, we are fine right now. But like anything else, it's hard to project out 2 weeks, 4 weeks, 6 weeks. At some point in time, yes, there could be a shortage of those supplies. But again, I'm sure Sanford's doing the same thing like every other hospital system in the country. We are working with our vendors and trying to come up with both standard supplies as well as new and innovative supplies. As an example, the swab, after it collects the sample, has to be put in a viral medium. We are in the process of making our own viral medium instead of buying it from a national or international supplier, as just one way that we're trying to be innovative and looking down the road to try to avoid shortages.
Okay, and my last question before I defer, do we understand or know from the time that somebody no longer is showing symptoms, they've recovered, that they are no longer contagious? Do we know that yet?
So your question, if a patient has COVID-19, is symptom-free, how long may they be spreading the illness?
Exactly.
I would say we've got some suggestion. I think we may be too soon into this to know with 100% certainty. We right now are telling our folks a minimum of 7 days. shorter perhaps if they test negative for the virus at the end of their course. But that, of course, can be hard because we're not going to have enough tests to test everybody who's convalescing from this. So I'd say details yet to be determined.
If you have a positive, would you, and they don't need maybe hospital care, are they asked to self-quarantine for a minimum number of days?
14 days typically, but
Okay.
yes, they are definitely told to stay home, isolate until they are symptom-free, no more fever, no more cough. Yes.
Thank you.
Counselor Erickson.
Couple questions for you. Whoever wants to I heard this question come up in the mayor's press conference this morning, and I'm curious if you can jointly ask it because it's two different hospital systems. How many hospital beds do you have the capacity to hold in Sanford, in Avera? I know it can change because you can move stuff around, and I'm just approximately, I guess I would say. And then I also know we have the Heart Hospital, we have the VA, we've got some other things, but for you both.
So speaking for Sanford, we are officially licensed for 545 beds, and that's public information. We, in our surge planning, would look toward doubling rooms, off-site, things of that nature. And so it really depends on and I hate to use the doctor term, it depends, right? Sorry, but we would look for, we have plans for significant increased capacity. I can't even give you a number because we have plans for significant increased capacity. It would depend on the nature of the illness, how ill people are, how fast they come in, things of that nature.
Well, and even if you move lower risk, if someone's having a baby and you move the baby ward to somewhere else, or I don't know if that's even an option, but I'm sure you're creative in how you're managing
Yes.
all of those.
Yes.
What I'll add to that is, of course, we're two large health systems, so bed capacity is not confined to just the beds in Sioux Falls. It's the beds across both of our systems, and we will utilize all of the beds throughout both systems to the best of our ability. So that might mean moving a relatively healthier patient here in Sioux Falls to one of our smaller hospitals in one of our regions. Again, just as an example of one of the many ways that we're going to try to maximize our beds.
Thank you. And I have one other question for both of you, and not to put you on the hot seat, so to speak, but I feel like that's where you're living right now, is the hot seat every day. So as we continue to talk, I was at the health board meeting I attended last week. Obviously, this council has voted on suggestions and recommendations from the health board. We've heard things all over the board, from shut down 100% to are there things we can do incrementally. As healthcare providers, are you suggesting that all businesses, that we should go in that direction as a council? Should we shut down 100%? Or what is that trigger in your mind for your systems that's where, it's not widespread yet in Sioux Falls or Minnehaha County. Is it that trigger of 20 cases, 30 cases, 40 cases? Where are we with your recommendations? Sorry.
Seat's hot.
Yeah, sorry.
Again, Dr. Wilde said it well. We're really holding the Center for Disease Control's recommendations as the single source of truth. From an infection control standpoint, anything we can do to minimize spread is a good thing. When we look at what's happened, how healthcare systems have been overwhelmed in China, in Italy, in the city of New York, I don't think we can delay in minimizing a response is not going to be helpful here. I think we need to act aggressively, reasonably, and do the very best we can, remembering the goal here. The goal is to protect our citizens.
And I get that. I don't know if you agree with that or if you had anything you'd like to add, Dr. Wilde.
What I'd like to add is, in medicine, we act rapidly, but at the same time, we really like to sit and think, and we really would like to have some more data on what happens. It seems to make sense that the more you shut down, the less infections you're going to have. But what we see in medicine often is what makes sense isn't reality. And there's multiple examples of that through time. Everyone, as Dr. Elliott alluded to, has shut things down in response to this because it seems to make sense. But we really don't know, and time will tell, if that's actually a worse thing, because then you have families living together in close situations and perhaps shedding within their family. We just don't know. And so, but at the same time, I understand our role and the decisions trying to be made. And the CDC guidance has been 10 or less and has been personal hygiene based on what we do know about this virus and how it's spread. Unlike some other viruses that we deal with where it's easily spread in the air, this one tends to be a more droplets on certain, a little heavier, so it tends to kind of stick to things and hang out there. And so the more substances shared between people, the more infections you can get. And so time will tell. There will be clarity in the answer if shutting a community down or shutting down household isolations is the better move. I don't know. The hygiene answer is the best answer right now. And following the CDC guidance seems to be, I think, probably the best guidance that we have available. And that's based on very limited evidence, very rapidly generated.
Thank you so much for answering that. I know it's a tough spot to be in. Obviously, the whole intent is, I don't remember which doctor said it last evening on Kello, but we can manage 10 at a time versus 100 in a day. And so based on what we're doing, it appears to be working. I mean, we are the largest city in the state, as and we're still way spread out than other communities and other states. But what we're doing appears to be working, and it's been essentially voluntary actions. We have a few people that think the rules don't apply and are going to make those decisions, and I get that. And it's a balance for us is, do you keep your lights on and keep a couple people employed and keep it under that 10? Or do you just shut everything down and deal with the repercussions that happen later? So I appreciate you answering that from a healthcare standpoint. It certainly gives me a little bit more to think about.
We're going to go to, we've got 3 counselors, I believe, on the phone. I think Counselor Sale, if you're there, you had a question?
Yes, I do. Thank you, Mr. Selberg. This two-part question. First off, as we know, the self-quarantine that a lot of people are doing with their children home and they're staying home, if some of the healthcare professionals could answer what should they be looking for while they're in their home that could either be COVID-19 related or other things like influenza A that they should be looking for and when they go. And my second question, and then I'll get off the line. Second question is, as this goes forward, at what point can we say we've turned the corner and it's time to get our lives back to normal? Those are my 2 questions. Thank you.
So the first question related to what should families be looking for at home. Changing advice, obviously, rather rapidly in regard to please calling first. So that way any facility you go to can prepare for what's coming in. Obviously, we're dealing with viral illnesses, which there is minimal treatment with the exception of influenza. So early diagnosis is best. And I would say with influenza, you want to look for high fever, lethargy, extreme runny nose, sore throat. The COVID-19, I would argue, tends to be, or what we've seen tends to be a little bit of a lower respiratory illness, and so you tend to see more cough, fever, shortness of breath. And those would be some nuances to look for. But I think the main message there would be to call before coming in, and that way can be properly triaged from that standpoint. Where this ends either with effective treatment that takes the risk off of a surge, rapid surge within a community and overwhelming resources. It ends with a vaccination, which, as the president pointed out just recently, those take time. Ebola vaccination was just announced, frankly, so it takes some time. But an effective treatment is where it ends. An unknown, unexpected cessation of activity within a community is perhaps where it ends. Who knows what leads to that, but sometimes that can happen. These are viruses. They tend to change over time. I think a flattening of the curve and a sustained flattening of the curve, similar perhaps to what we're seeing currently in China, where there's less and less new cases being diagnosed. Those are a couple of scenarios in my mind of where I think this could end.
Yeah, I don't think anybody can give us a date, maybe not even a month. When this ends, when we can resume some normalcy, we are going to have to wait and see. As Dr. Wilde said, the numbers are only going to go up right now. They will eventually plateau. They will eventually start to come back down. I think we're going to have to start to see that sort of data before we can say with 100% confidence that we can put our kids back in school, or we can open up our long-term care facilities. Thinking about it logistically, I don't think we're going to open up everything on day one. I suspect the reopening of the businesses within the community will be somewhat staggered.
Thank you. Councilor Kiley, I believe you had a question?
Yes, I do. And this is for either or both Dr. Elliott and Dr. Wilde. I continue to hear individuals downplaying the seriousness of the coronavirus, COVID-19. Some have even gone as far as saying it's the natural order of things. Viruses come and go, that more people die from the seasonal flu than have died from COVID-19. Of course, they're somewhat ignoring the fact that we're just weeks into this pandemic, where we have been into the flu season since October, so nearly 6 months in the flu season. And the other major issue with this, the fact that we do not have a vaccine. We do have a vaccine for the seasonal flu, which does have a degree of effectiveness for the general population. How would you address those types of comments?
I think the one way to address it would be the coronavirus the outbreak we're experiencing, and the illness is called COVID-19. The data out of China, the case reports out of China, which is, I think, the best reports we have, since other areas are still quite affected and not getting great information out because they're still working on it. But it shows that there's probably, of those affected, around 80% have cold-type symptoms. And it's the 10% that maybe require higher levels of care, like hospitalization, and the 5% of those, and my numbers are intentionally rounded just so I can keep them simple in my head, that require the ICU care. And so the vast majority of people that get this illness have cold symptoms, and they self-isolate and do just fine at home. And so I think that's where people talk about, make some comments, but the reality is those that do get markedly ill with this, there's enough of them because virus can get so prevalent within a community that they can rapidly seek care and overwhelm resources within a community, leading to rather significant community events, as has been seen in Italy, and Italy's more reported, of course, than China, and that's probably what scares us the most, I would say, in comparison to influenza, which absolutely affects more on a seasonal basis. We have more history with influenza, and it can be rather predictable. Absolutely exceptions to that, but we kind of know what we're going to get. With this one, it's just so unknown because it's so young in society.
Yeah, to answer your question, we're too early into this to be confident that anything is working well. Don't let the small numbers in the state of South Dakota lull you into a sense of confidence. We've got a lot lower number than New York. We've done a whole lot fewer tests than they've done in New York. As our number of tests ramp up, I assure you our number of positives will ramp up as well. So now is not the time. Now is not the time to relax our efforts or to say, okay, we can return to life as normal. We need to stay vigilant on this until we have clear epidemiologic data that we really have gotten to the other side of this. A colleague of mine, Dr. Dave Erickson, has used this phrase now for about a week, and I think it's very appropriate for all of us here. Anything done at the beginning of a pandemic will seem alarmist. Anything we did after a pandemic will seem insufficient. I do think that this council is going to have to think about that in making plans for the future.
Thank you. Any other questions, Councilor Kiley?
Yes, I do. I have a follow-up, and thank you for your answers, Dr. Elliott and Dr. Wilde. There's no doubt that we've had challenges in collecting our ability to collect the data. Some of that is due to a shortage of tests, a lag in getting the test results. It's promising that both Avera and Sanford Health Systems are online now to provide us with more of the testing results. With the lack of this information, is it possible to apply factual data that's been collected from the many other areas and locations across the globe that have experienced the community spread that we are seeing now in South Dakota to help us move more quickly and decisively? I do agree with you, Dr. Elliott, that I think this council needs to be prepared to initiate further measures.
Yeah, if I understand your question right, can we use data coming out of other states to perhaps predict what's going to happen in South Dakota? The answer is yes. That's the best data we've got at this point in time. So we are working on forecasting models. What would South Dakota look like if it had the same rate of spread that a state like New York or Washington had? Until we get our own robust state data here, which will come with time. I have no doubt that it will. We have to look at other states, other countries as models for us.
And I would just point out the caveat that in medicine, and I alluded to it, and I'm going to allude to it again, how new this illness is in humanity. It's been studied in a Chinese population. It's been studied, starting to be studied in an Italian population and urban centers like New York, Seattle, et cetera. We will know at some point how it acts in a upper Midwest community, but we don't have that exact information, which is what we really like in medicine. Until we get that, we absolutely are looking at those models that have been generated and making our best estimates, and that's really one of those things that really kind of keeps you up at night is what exactly is going to happen, knowing that it hasn't been studied in a community like Sioux Falls.
Councilor Brecky, I believe you had a question?
I do, and you've pretty much answered it, but I wanted to take, I guess, the same line of questioning that Councilmember Kiley did and take it just a little bit further. As I understand it, from a nationwide perspective, the three big issues are ventilators and the masks, the protection equipment, and the bed space. And as best as you can at this time, I'm guessing what you're trying to do is put together what your plan is and what your best hypothetical is what our numbers are going to be, without asking you, to give us specifically what your, what your best theory is right now. What is your level of confidence, about, being able to wrap your arms around it and our ability to meet those, those demands, the ventilation equipment shortage, the mask shortage, and the bed space.
Yeah, of course, we're working on that with Avera, with all resources. And really, it speaks to the importance of, we keep using the term, but it's so true and meaningful, of flattening the curve, is we have every confidence in our community's ability to respond to a steady or even a rapid increase in patients, but there's a point where, and I don't even have the point, but there's a point where there's going to be overwhelming, and that's why it's just so important, because these folks that do come into the hospital, this is not a rapid illness that clears. The average length of stay based on data out of China, I believe, was 10 days. I think out of Washington was 12. And so you can see how exponentially, and I spoke to this a few days ago, you can see that if you were to get 5 patients a day that are going to stay for on average 12 days, that can add up really quite quickly. And so it's how slow those patients can come in that can determine our response and our ability to surge and keep our patients, our staff, and the community safe.
And then just a follow-up question along that line, is there a benefit to early detection, and is there any wisdom in mass testing in order to try to get ourselves in an early detection position?
Yeah, I would argue that there is some benefit to early testing, mass testing, to understand the way the disease is spreading, where it's headed. But with limited resources, we have to prioritize who gets tested. And with limited resources right now, our priority is on those patients that are ill enough to require hospitalization, or healthcare providers that are exposed to those ill patients and may need to be out of service for 14 days if those patients test positive. So is there benefit? Yes. It's hard to do, though, with a limited number of tests.
Thank you, and thanks for all that you're doing.
Councilor Staley?
This just came to my mind. This morning we heard the mayor at his press conference referencing a suicide. And I know Avera, we've got a behavioral health center, and I'm sure Sanford does something as well. I'm going to challenge you two guys and your systems to reach out to the public and tell them that there are resources available for families, individuals who may be on the brink of some kind of desperation. Because especially as we're going to be talking, I don't know what's coming tomorrow, but we're going to be having these discussions about shutting things down. And our mayor said it so well this morning that we've got the physical health, but we've got an emotional wave of turmoil coming at us. I think he said he called it devastational, brink of bankruptcy type of things happening. So we've got to be attending to people's mental well-being and giving them hope and encouragement as well. So please think of that. And then the second thing, how, at the end of the road with this illness, is it showing itself as pneumonia? Would that be, what I mean, because to me, it's still kind of a vague thing as to what actually is happening to people when they're being hospitalized. But somewhere I read or saw that it was, that pneumonia is what is really the end game for this. Is that accurate?
That's fair. As I alluded to earlier, it tends to be a lower respiratory presentation. What I mean by that is cough, fever, shortness of breath. And then as it progresses, and when I say progresses, in the vast majority of people, like I stated earlier, it progresses to resolution and people feel fine. Those that continue to get more ill with this, it does tend to be significant cough. There does tend to be an abnormality on chest x-ray consistent with pneumonia. Pneumonia is what we call an infiltrate on chest x-ray, and then the question is what's causing it? Is it a bacteria? Is it a fungus? Is it a virus? And so this does tend to be a viral pneumonia. And then even half of those people can improve with supportive care, oxygen, nebulized breathing treatments, et cetera. And then unfortunately there's some that do not improve, and they tend to get an inflammatory reaction in their lungs that requires external or mechanical ventilation. They also can develop heart rhythm problems and other problems with the heart as well. That tends to be the two most significant effects of this illness.
Well, and I saw NBC had a great special on last week, and I think they said that half of the people that go on ventilators don't make it. That's what Lester Holt had on. Well, and another question here. So the end result is we don't want people on ventilators. That's why we're trying to stop this ahead of time. But do antibiotics help, since it's a pneumonia-related thing? Do you know, is that effective?
Since coronavirus is a virus, antibiotics do not appear to have any effect on it. Now, if there's a secondary infection, then potentially antibiotics could be helpful. But for the virus itself, no evidence that I'm aware of that says there's any benefit in routine or novel antibiotics.
But once it becomes pneumonia,
if there's
then it's gone past the...
If there's a secondary bacterial infection, then antibiotics that fight that bacterial infection could be helpful. If I may, I much appreciate your comment about mental health. And as you know, we're blessed here to have one of the best mental health facilities in the country. We have a tremendously talented group of psychiatrists, psychologists, counselors. The mission of both systems certainly is to take care of mind, body, and spirit, and we take that seriously. You know, Vera opened up a farm hotline for some of our farmers that were distressed with the unfortunate weather and the economic hit that brought on. And we are discussing how can we best help our members in the region with the mental stress that this is undoubtedly going to create.
Councilor Neitzer.
I'm so glad and so in agreement with what Councilor Staley brought up, because one thing that I've struggled with as I know these decisions are coming is that I've tried to discuss with people that let's not lose sight. This is not an either or, that you're either for health or you're for economics, because all of these decisions are a balance. Imposing these sorts of things could have wide-ranging consequences. The physical and emotional toll, the anxiety, the depression, unfortunately could even lead to suicide. A lot of people are living paycheck to paycheck. They lose one paycheck, they now have food insecurity. They're maybe not feeding their families. They may be looking at homelessness, and it's just a cascade of effects. And that's the balancing act that we're going to have with any decision that we're faced with. I do have two questions, but I just so much love that was brought up, because I think that's what we're really ultimately going to really be struggling with, is it's not just as simple as just, well, just close businesses and everything will just all be at home. My questions specifically for you are your healthcare workers. If they are exposed, and it was alluded to a little bit, what happens to them? Are they out of commission entirely? What is the protocol?
It's a simple question. Unfortunately, it's a complicated answer. It depends on the type of exposure, whether the person was positive or a person under investigation, how long the exposure was, whether the exposure occurred while it was feared that the patient may have been aerosolizing the virus. All those things go into determining what do we do next. But yes, it could easily be, go home, monitor your symptoms, and self-quarantine for 2 weeks. And you can imagine how impactful that is if even a small percentage of our healthcare staff is told to go home and quarantine for 2 weeks, how that can impact our ability to care for a large surge of patients.
And again, this is evolving and you're still learning, but what's the current understanding of how long before somebody shows symptoms are they contagious? Because there's been discussion about that people are asymptomatic, but they're showing symptoms, but they're contagious and spreading it.
Yeah, I'm going to let Dr. Wilde chime in if he knows better than I do, but I've heard 24 to 48 hours before a person is symptomatic, they may be contagious. That's part of why it's so difficult to, contain the spread of this virus.
Thanks, Dr. Elliott. As I recall, literature I've reviewed, it can be up to 5 days that someone can be contagious without showing symptoms. I'm speculating now, but that could have been the extreme of a range. I certainly would agree, just on knowledge of viruses, 24 to 48 hours. I'd also add on that's some of the work that we've done within our rapid decision making as we continue to look at scenarios that come up, an exposed person, and how rapidly we've evolved as this has become present within our community, in that we at Sanford will absolutely follow the CDC guidance, and that's where this is coming from in regard to if we have a healthcare worker or a caregiver that's exposed, we would mask that person, monitor for symptoms. They could continue to work, but at the first sign of symptoms would be asked to follow the process in regard to should they be testing, for sure self-isolate. But we do mask in regard to protecting the public and their coworkers.
Oh, thank you. And last question is, can you help us, since not being doctors, sometimes the term aerosolized is thrown around, and also I think related to that probably has a lot to do with somebody directly, maybe 2 feet from me, they sneeze. The difference between that versus somebody 10 feet away sneezes and I walk past it 2 minutes later. Can you tell us about the aerosolized and what the best form of transmission is?
Sure. I'll start, since I had alluded to it earlier, and hopefully not get real graphic here, but aerosolized means to put into the air. And so the reality of respiratory viruses is they get in, your body's response is to get them out. And so you cough, you sneeze, you produce tears. In those secretions are the virus. And that virus, it depends on, kind of the size and the makeup of the virus. It can kind of aerosolize, float through the air for some time. Some of them are a little heavier and they tend to kind of live in the secretions for quite a while. And so you may not get the virus from a distant contact, and I'm talking about the coronavirus in this case, necessarily from a distant contact, but a close contact. And the reality is you have someone that maybe has a little sore throat, some cough, some stuff flies out as they're talking, we all talk, right, or eat and things like that. And if any of your respiratory surfaces come in contact with that, you could be at risk for getting infected. Or if some of that secretion is on the surfaces around you, you could come in contact with that. And so that's, I'll kind of leave it at that without getting too graphic here. Yeah, and so that's the CDC guidance in regard to the 6 feet. Just be based on, you know, this doesn't, and I alluded to it, influenza tends to aerosolize, RSV, yeah, thank you. Not so much, but influenza definitely tends to aerosolize. There's other things that really tend to just be in the air around you, but the 6 feet rule in regard to the coronavirus is there for that rationale. This is a heavier thing. You can be relatively close to people, and that was some of the early data that came out of China on household contacts. Is it was pretty seldom that people living in the same household actually developed the illness, even though they were exposed to the person quite often, as long as they exercise proper hygiene and isolation.
Any other questions, counselors? All right, I have a couple.
Mr. Chair, I do.
Okay, go ahead.
Doctors, in addition to the symptoms of cough, fever, tiredness, and difficulty breathing, have you heard anything about losing sense of smell and taste as being additional symptoms?
I'm just aware of it only out of case reports out of Italy with physicians that had been exposed, and they do lose their sense of taste and smell. I haven't seen any reports of that in the United States.
Okay, thank you.
You bet. I have a couple of questions. The first one's probably for Director Franken. On this kind of rating system that we hear about a little bit, like 0 to 5 cases is maybe minimum to moderate risk, and we hear substantial is 5+ cases. What is the recommendation CDC-wise for either category? Can you maybe school us a little bit on the breakdown?
Yeah, sure. So the CDC has an implementation of mitigation strategies for communities with local transmission. And so what we've been working on as Unified Command and the EOC, and I apologize, this is starting to get a little like out of the order that we had kind of wanted to have happen. So we're going to just work with it if that's all right with you guys.
Sounds good.
And we'll kind of sort out what we need to give you updates on once we've gotten through some of the information from the Q&A. We've been working off of this guidance and from the CDC, and it does lay out the mitigation activities according to community transmission. And so again, community transmission would be when you have a case of coronavirus that you do not know from where that person was infected. And so you will hear a lot about travel related and versus community acquired or community spread. And so if we know where that person, like they got it from somewhere else and then traveled back here and became sick, that can be explained. Once you can no longer say where that person got it from, that's when you start the level of concern about spread in your community is going up, because then you know it's happening in your community. And so that's what we're really on the brink of waiting for, is that first case of community spread, because once we have that, we'd be in the minimal to moderate category of spread. And that's where, if I might, I was prepared to share with you that there are a number of states who have taken action after they've had that first, when they get to minimal and moderate. And then that would be 1 to 4 cases, and 5 or more would be substantial. And so, for example, Beadle County is really in its substantial level right now versus McCook County, Sandy and Regan. Is McCook County in a mild to moderate right now? Yes, that would be an example of a county that's in mild to moderate. Let me just for a second contrast that now with what we're seeing happening around us and how other like states, whether it's state jurisdiction or municipalities, are handling that. I think it's important for you to understand where we are situated in Sioux Falls and what's going on around us in this area, but also around our state as a whole. So Iowa, for example, on the 14th of March, they had their very first case of community spread in the state, and on the 17th, they initiated measures to reduce and to mandate closures of certain entities. They mandated movie theaters, coffee houses, breweries, gyms, dine-in, restaurants, bars, casinos, senior citizen centers, adult daycare facilities, et cetera. And they made that for a time period. They had it from the 17th through the 31st. And so that was in Iowa. Then in Minnesota on the 16th of March, they had in one day, they had 3 cases of community spread in the state. So they went from 0 to 3 cases in the state, and they initiated a statewide. In Iowa, that was a statewide, by the way. And then in Minnesota, they also, the very next day, initiated a statewide of all bars and restaurants closed to dine-in services from March 17th through the 27th. And then also Minneapolis took some additional action as well. We also have Nebraska. Theirs was a little different approach. They had a case in Douglas County on the 14th of March. 5 days later, or the 19th, Douglas County took action specifically for dine-in restaurants and bars and to restrict patrons for services that were within those entities. And then, so that kind of gives you a sense of what's right around the Sioux Falls or the southeastern South Dakota area, right? And then if you look at North Dakota, on the 18th of March, they had their first case of community spread. On the 19th, the day later, they took action that all bars and restaurants would be closed to dine-in services. And they, I don't believe, have an end date on theirs. They just initiated that for March 19th. And then lastly, Wyoming, they had their first case of community spread on the 19th of March, and they also then had a closure that same day. They initiated closures of all bars and restaurants closed to dine-in services effective March 19th. They also took specific action in Laramie County. So I share that with you. We also know that in South Dakota, we've got action that's happened. We have the executive order from the governor that I think was provided to you in advance of this meeting on SIRE. And so that action has some elements to it that are for businesses, specifically for purposes, and I'll just read to you the section.
Director, before,
Yes.
Mr. Chair, if I might, I think we're done with Dr. Elliott and Dr. Wilde. I don't believe we have any, I mean, we want to get them back to important things if we're done asking them questions, but
I've been made aware of that, but I do have a couple questions for them, but I was waiting for her to answer
good
this
then.
one.
I just, I
Is it
didn't
all
know
right
we
if I
were jumping
continue
in.
to share this
Absolutely.
information? All right, thank you. So we also have that, you have the governor's executive order that we've been working very closely to understand where we're at in how that applies to Sioux Falls specifically. And so those areas, we know there's recommendations for all employers, both profit and not-for-profit in the state of South Dakota. But there's also then recommendations specifically for bars, restaurants, breweries, casinos, coffee shops, recreational or athletic facilities, health clubs, and entertainment venues. Just so you are aware that we're specifically trying to work through and understand what it means around suspending or modifying business practices as recommended by the CDC that involve 10 or more people, to be in an enclosed space where physical separation of at least 6 feet is not possible. And then we're also trying to understand how we will restrict public gatherings of 10 or more people unless it is necessary for those particular entities, as well as review their business practices to make sure they're following the executive order. So that's information that I wanted to share with you based on the question that you asked.
Okay, I think I followed most of that. Thank you.
You bet.
Thank you. All right, for the doctors, and then we'll get you on your way. Sorry to keep you here an extra few minutes. Mike, a couple quick questions for you. Have you had to quarantine Any staff, you talked about that from Councilor Neitzert's question, I believe. Have you had to quarantine any staff to this point? Whoever wants to answer, either or, if you've had to or if you haven't.
Yes, there have been some of our staff out for some with illness symptoms, some with exposure. So yes, it is already having an impact.
Okay. Anything to add to that?
Yeah, our initial policy was to quarantine, and we have. And as guidance has evolved, our policies evolved as well, like I alluded to.
So the people that are quarantined right now have been tested or they may have it, or it's just been out of a safety precaution, or?
I'm gonna speculate to having great knowledge of our HR process, but we go by what was in place at the time of the exposure, and then of course we're monitoring for symptoms. And as the situation changes, then if someone is in quarantine and the guidance is to go from 14 days down to 7, they're not showing symptoms, we may have them, and please understand that's hypothetical, but we may have them come out of quarantine sooner based on evolving information from CDC.
Okay. Okay. My other question for you, we watch these press conferences daily, nationally as well, and I always see the governor of New York come out, and I watched him yesterday, and he talked about he's going to ask hospitals and the cities and wherever they might be to possibly increase their capacity 50%. And I think somebody had asked you this question earlier about beds. I think you said you had 545 beds at Sanford, if I wrote that down. Did you cover, I mean, is 50%, is that even feasible here? Or is that that kind of hit me yesterday, and I was wondering, is that something a politician throws out there and then you go, that's not going to happen, so whatever, or is that possible in Sanford or Rivera?
That's an interesting ask, but 50% is reasonable. You'd look for detail. Do you mean, just 50% more beds or rooms?
I believe that's how it was. Well, yeah.
Right. But yeah, it's reasonable. It's unusual, but.
Nothing to add to that?
Yeah, there's so much detail in that.
Right.
Do you want 50% more negative airflow rooms? Do you want 50% more ICU rooms? 54 more general med surge rooms? So
a lot of ways to dice it up is what you're.
Yeah. So we absolutely have the ability. We already have increased capacity, and again, big health systems. So we're going to be utilizing beds across our health system. Have been working very hard on our surge capacity.
Okay. My last question, the people that are recovering from this virus, is it just time? Obviously there's been no cure. What's so far been the theme to it, the folks that have talked about people are recovering, is there a certain theme to what that's been to this point that have gotten through it?
It varies a little bit by how severe their symptoms were while they had the illness. But like many viral illnesses, it's kind of a slow and steady improvement. Some folks have been ill enough to be in the hospital and have recovered. Some folks have had very mild illness and recovered, and of course they recover a lot faster than those that were sick enough to be in the hospital. That's a vague answer to your question, but it's all over the board as what I would say.
Okay, yeah, that's probably as deep as we'll get on that. Anyways, thank you all very much. Thanks for your time. I know you've all had a long way.
Mr. Chair, if I could just also say, it was so valuable to have you guys here. And I would hope you could come back again, because I think we all learned so much. And we certainly get great information from our health director, but having you guys right at the center of what's happening, please come back again.
Yeah, we appreciate your time a lot. Thank you all.
Our collaboration with Jill and Sandy and Regan and the mayor has been exceptional. So we're proud to be a part of the city. Happy to come back anytime you think we could be helpful.
I have a feeling the way things are going, we'll see you soon. So, all right, thanks everybody. Director Franklin, do you want to finish up?
Yeah, I just want to share a couple of other items. You know, first off, we have the Emergency Operations Center up and running, and we have a number of sections of that that are working with additional items that are related to the healthcare systems to make sure that wherever coordination is needed between the city and the health systems, or to assist them in coordinating together, that is that happens within the EOC. We also have a group that's working, and it's called the Continuity of Operations Group, and they're really the group that are, and the section of the EOC that's working on all the elements of making sure that all your city functions are operating as they need to be. You know, when you really specifically look at all those essential jobs that and functions of the city that we need to continue to maintain, how are we able to do that if we have a workforce that is decreased because of exposure to coronavirus, whether that's being quarantined or isolated, ill, et cetera. And so we have plans that we've had in place for a while, and those plans are, you know, being revised and renewed, and we're working on how we're going to make sure we're ready as well. And I would say that we're becoming well ready to meet the challenges. But this is going to potentially have an impact on your workforce as a city. This is going to have people that are going to be out ill, or they're going to have family members that are ill, or they're going to need to be home in isolation. And so it's a reality that we're going to see, and not just now, but into the future to a greater extent. And so we want to make sure we're ready for that. You know, we also have a group that's working with the vulnerable populations. You've alluded to that, Councilor Staley and Councilor Neitzer. When you think about the folks that are more stressed or have increased stressors, or we look at the social determinants being impacted by this, what we have to do as a community to protect ourselves and make sure that we do the work of making sure we can get through this as best as possible. And so there's a group that's working on how to make sure, so for example, if someone is found to need to be tested and needs to be in quarantine until that test comes back, and they are, say, at a homeless shelter, where can they're finding places for them to be able to be safely in quarantine and have the resources such as food, et cetera, that they need. And so that's a group working on that as well. So I just wanted you to be aware of that. I also want you to know that there's going to be some next steps that we're going to be working on, and some of that we'll be working on yet tonight as far as recommendations that we'll be making to the Board of Health very soon here. You know, it could be as possibly tomorrow or the next day, and that all revolves around when we have community spread in our community. I alluded to this when I shared some of what's happening around us. I think that we have to really think about, you know, you've asked such good questions of the healthcare providers, and we are doing a really good job here. I think we have a great capacity to see that curve be flattened, but we haven't even gotten to the very beginning of the curve happening yet. So please be aware of that. We are seeing symptoms. If I think of Sioux Falls as my patient, there's symptoms of that starting to take shape, but it's going to come here, and we have to be ready. And being ready is making decisions that we need to make to further assure that that they are social distancing. And so those will be recommendations we'll be making to the Board of Health, and will possibly then come to you. So thank you.
Thank you. Councilor Neitzer?
Thank you. So this is where they say, as the devil is in the details. And I know this is what you're probably struggling with. And I'll just, to set it up, I'm looking at two documents. First is implementation of mitigation strategies for communities with local COVID-19 transmission, the CDC document that kind of gives you a roadmap. Now, that's 10 pages. Unfortunately, as many things in life, things are not always black and white. So it doesn't say, if you have this, close this, do this, 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 and this.
Correct.
It's very broad and over, you know. So the first question is, once we confirm we have community spread here, would we be in the substantial category in the terms of the level of transmission?
The way that we have been advised by the State Department of Health is we'd be in that middle range, so mild to moderate is where we'd be with that first case.
When do you hit substantial?
5 cases.
5 cases that are deemed community spread.
Correct.
Okay, so looking at that document, and then the other thing that's giving me a little bit of a guidepost would be Governor Noem's executive order. And as you talked about, the difficulty is when you get down to the retail business, I'm just going to focus on that, is it talks about suspend or modify business practices that involve 10 or more people, and then the question is, well, what does that mean? So digging into that, I've been trying to understand, when you talk about groups of 10, are we talking about groups of 10 people within 6 feet of each other? So as an example, if I have a very big store and I have 8 people on one side of the store and 8 people on the other side of the store 100 feet apart, is that violating that dictate?
Well, that's what we're trying to understand, is based on that 10 or less, that you could, if there's 10 people or less, as long as they're 6 feet apart. It's that section in the executive order. That's what we're trying to understand and get more guidance on from the state.
Yeah.
I would tell you, that's what you, when you said devil's in the details, it is those details that the point of this is we need to take the action that's needed so that we don't have community spread. And we have to, sometimes we have to make decisions, and it's really unfortunate, isn't it, that we don't have the luxury of time on our side here to be able to ponder these decisions. Because right now, even just determining that alone and having all of the restaurants and bars clearly understanding that and making sure that that's being enforced, that right there is a body of work that's going to need to be done, right? And so just understanding that one element in that executive order is what we're trying to work on right now, along with, you know, a couple of others that we know we can impact. But yeah, we don't have the definitive answer on that yet, but we're working on it.
And I guess I get that to an extent about not having time, but I also would push back a little bit that I guess I'd be a little careful not to, in a panic, that we close everything down and we just say we don't have time, so we're just going to close it all down. And I don't know that you're saying that, but it's a balancing act.
Yeah, and if I can comment on that.
Yes, please.
It absolutely is a balancing act, and that's why we've been working really hard, and that's why we have a unified command at the EOC, so that we're making decisions, you know, between, you know, myself and Dr. Wilde and Dr. Elliott. We sit down every morning and we're talking through this, and we're understanding. But we've agreed when we have community spread here, we need to act, and we need to take action, and that's not waiting for 5 cases. And that's what you saw. That's why I shared with you what the other states have done. The minute they had community spread, they took action. How we think we're so different than North Dakota or Minnesota or Iowa or Wyoming, that we shouldn't be taking action. And that's what the one thing about the guidance that I've seen is that many folks, you know, when we think about when we close schools, you know, if you think about the guidance that's out there, and then when it was decided to close schools, you know, that you have that guidance and you use it to the best of your ability, but then you also have to make good community decisions, right? And that's what you have to also work off of, so.
Sure, and that's where the difficulty, for example, in trying to understand what is, you know, in best practice, a good idea and a bad idea. So like, you know, if somebody has a small business and they typically have one customer at a time trickling in, and they're definitely, or they do things to change their business model, and kind of as the governor was alluding to, you know, do you just shut everybody down? Or do we have something where a lot of restaurants have done things like they've closed and they just say, we're only doing takeout and drive up, and they're behaving, but you have a few bad actors. You know, what would be wrong necessarily with saying, we are gonna come down and we're gonna find the bad actors, but we're not gonna close you all down? Just.
Well, I would say that there is some opportunity to be able to say, if you can demonstrate, but I think you'd want to clearly articulate what that demonstrating is, so that you give some guidance, because that's one of the things we're finding that folks are struggling from, is not having clear guidance in all matters. And so we're getting a lot of questions about, you know, well, what should I be doing? How can I be making sure that I'm, you know, doing the best job that I can? So I think, articulating things in policy that are around dine-in, takeout, curbside service, and really encouraging that and saying, those are the things that we think should be done right now if you have a restaurant, and you know, those are the kinds of things I would say give a better sense of they don't have to close their business down, they just have to change their business model for a defined period of time, perhaps. And then you give it that defined period of time with the option to say, if we still are having issues in our community, maybe we extend it beyond that, but you start out with a definition that's defined and then, or have specific criteria of when you would end it. I guess I'd probably be more in favor personally of defining a time period so that you know that you have a stop date, and you can always renew that stop date.
I have more, but I'm going to be respectful and
Counselor
defer.
Staley.
Thanks.
So, Jill, are there are states, municipalities that have said all these businesses will close?
A lot of them are saying if you can, you know, do carry out, drive-through, curbside service, that you're allowed to operate.
And then back to Councilor Neitzert's question, if you have one person come in, if you're dealing with one customer at a time, would that be, or is it more of a coming into the building that is problematic?
Well, and I think that's, you know, the difference between, you know, looking at the services. We spent a lot of time when we put out the press release on Sunday of really thinking about what are those elements where people congregate in groups and they're sort of in places together, and that's what you really want to try and avoid, and you want to make sure that you're not having that occur for a period of time, because that's that social distancing that at some point we have to ensure is happening for a period of time to make sure that we aren't getting that surge to our hospitals, because of once all those people are infected by someone who is positive with coronavirus, then those are all people that are potentially going to add to that surge after a period of time when they get sick. And that's just going to add to overwhelming the healthcare system. So that's why taking a time period here when we know we're on the brink of that curve starting to go up, that's when we, you know, should be taking now action in my mind, and real soon.
Councilor Erickson.
Thank you. Just kind of going off of what Councilor Staley and Neitzert both were talking about, you said community spread. Who defined that trigger in South Dakota? Is that your trigger? And I'm not saying that to be snarky, I'm just questioning where that, is that a CDC guideline that in a county, if there's...
No, it's you know, when I referred to that in the mitigation strategies and the CDC guidance, the minimal to moderate is that 1 to 4 of community spread. And community spread, again, is when you have no knowing, you can't discern through the investigation that, like our State Department of Health would do, where they contracted that illness, that virus, where they were exposed. If you can no longer determine that, then that's when you have community spread. And so, you know, anywhere from 1 to 4 is considered minimal to moderate, and then after you get past 5, you're in substantial. And so what I'm sharing with you is all those states that in the minimum to moderate category took action. They took action at that time, and that's when they decided they needed to get control of this to avoid the surge and flatten that curve.
Okay, that makes sense. And, you know, as we look at this scale of doing nothing to shutting everything down, we've got this timeline. Instead of going from 0 to 100%, what are those incremental changes or steps that we can rely on the experts, facts and science, to say, okay, the CDC is saying groups of 10 or less. We're gonna allow that, except for gas stations, grocery stores, pharmacies, whatever those essential kind of things, or if the mindset is entertainment, if they stay under 10, that's what the CDC is saying, because we're essentially what's being asked is going above and beyond what the CDC is even recommending.
So my best answer to that today, I'm sorry.
My question could change in 45 minutes. I mean, that's how crazy all this is.
What I am understanding is that when you look at where people are socially gathering, you know, it's often in the bars, it's often in the restaurants, it's often in those places that are just really, you know, gyms, movie theaters, malls, etc., where you have a lot of people that don't know each other that are getting together and they are cohabitating for a period of time, and you have no knowing of that there's someone in that group because you don't know people that are in that group, and you are likely going to be exposed to someone. That is what you want to try and avoid. And so I think that's, you know, from a reasonable perspective, that's why the list was as it was of looking at that particular group, because you're looking at people who are going into large group settings, you know, of more than 10 people, most likely, and they're most likely not knowing each other. They haven't been cohabitating with each other, you know, hunkered down and socially isolating, like, say, a family that might be large groups together amongst people that don't know each other, and that's where the likelihood of spread is going to be greater.
But if we suggest, or if we say shall, say we implement the CDC guidelines and say, you shall close if you are within this defined role of bars, restaurants, whatever it is, the defined role, saying you have to comply with the CDC of 10 or less. I mean, you're not going to have a whole lot of unknown people crossing paths with a group of 10. It allows you to go in, pick it up if you want, et cetera, et cetera. The reason why, and let me preface why I'm asking that, is because I had a couple businesses reach out today that said, allowing that CDC, I don't have to choose. If you implement those CDC guidelines of 10 people or less, I can choose to pay my light bill and maybe make my mortgage and still get enough I'm still losing tons of money, but I'm squeaking by enough to where I see hope. And I understand you're looking at this with a lens of health, and I get that and I appreciate that. And we have to find that balance of someone's livelihood, of making their mortgage payment, making sure they have food on the table, and it's an awful place to be in making that decision.
Well,
so
I'm going to disagree a little bit with you that I'm all health, because I have been interfacing with a lot of businesses that, and trying to help them understand how can they socially distance. You know, we have, for an example, you know, one CPA firm that decides to close their office completely and another CPA firm that decides to really figure out creative ways that they can stay open. So, you know, I'm not saying I don't think every CPA firm in town should shut down.
No, but I'm just talking about the restaurant bar aspect. I'm not saying, well, like when we say 100%, I'm talking those entertainment venues, because let's be honest, most have complied. We can all probably name 5 or 6, and I'm not going to, because I'm not, but some are very shocking to me that are still open and leading as an example. And so others are going, heck yeah, look at this. I can capitalize on being elbow to elbow in a nightclub, so to speak. And they're, I mean, essentially saying, rules don't apply to me until the government does something. And I strongly disagree with that, because the South Dakota way is being a good neighbor, looking out for each other, and making sure that we make those decisions that impact others less, but you can still keep your doors open enough to not have to rely on somebody else. And so it's that awful balance. And it's the other component I will bring to that is the balance of the timing of it. As we've heard, the surge coming in mid to end of May, we have to be able to sustain a closure for 8 weeks. So a couple of the businesses that reached out and said, if you close me down now and expect me to stay closed for 8 weeks, I am 100% done. I'm done for it. But if you do it in an incremental step to where we can still bring in a little bit of income and be responsible with following the CDC guidelines, I'm squeaking by, barely squeaking by. They may have 1 or 2 employees on, and that balance for that industry that is very heavily, I mean, it's very different than a CPA. It's very different. And so if we can allow some of those to squeak by and do it in a healthy way with the experts telling us that keep it 10 or less, it's really hard to look somebody and do that. But I know the balance too, because just a few moments ago, there was breaking news on the Argus Leader saying a Laurel Anderson teacher is diagnosed with COVID. Now what? I'm a parent. We all either are parents or have grandkids or whatever. And so now the hysteria of parents of small children saying, that was my son's teacher. Then what? I get it. I do. It's not a fun place to be in for anyone.
All right, since we open it up for round 2 here of questions, any of you on the phone have anything else?
Yes, Mr. Chair.
Go ahead.
Thank you. You know, I do understand fully the concern and the impact that closing non-essential businesses will have on the businesses as well as the community of Sioux Falls and any of the individuals associated with the business. Our business, the South Dakota Safety Council, has been closed down for a week and a half and will remain closed down a minimum through April 15th, and then we'll continue to assess. Believe me when I say we're concerned about our ability to sustain that, just our ability to continue to pay individuals that work for us. But right now, one of the few tools we have available to us is the closing of non-essential businesses in an effort to flatten the curve. Also in an effort to reduce the surge of cases so that our medical community can at least keep their head above water. The last thing we want is for this to reach exponential growth, because once it reaches exponential growth, it's out of control. Regardless of what we do, we won't be able to reel it back and then eventually flatten that curve at a later date. So I get it. I fully understand it. But I think when the time has come and the medical community tells us and the health officials tells us the time has come to seriously consider the closing of non-essential businesses, I'm going to follow what the medical experts have to say. That's all. Thanks.
Thank you. I don't know if you have any comments back to that, or you're good? Okay. Councilor Neitzer?
So I'm not sure if I heard the medical experts say that. I guess so. What I struggle with is, and I get it, we have to make definitions, but one struggle I do have is that to the owner and to the workers, no business is non-essential to them, and that's the. I mean, you know, so obviously it's a huge struggle, and I get the difference in a way, but and you totally agree, is that it's also a difficult thing. I guess what I'm struggling with is I do not want to get behind the curve. I don't want the overrun, but I'm just trying to figure out, you know, if you could solve the problem without, you know, as it was said, you have 0 to 100 on the speedometer. If you could solve it at 60, then do you need to go to 100? You know, so that's where they were trying to, I think we're struggling a little bit with that. And I know you are too. You have that whole command, and you're not just thinking in one lens of health. It's a whole ecosystem, and you're thinking about it. So, do we have, and I haven't, I'm sorry, I haven't read the press release since this weekend, but non-essential and essential, do we have a clear, that's where the people are going to be asking a lot of questions. Am I essential? Am I non-essential? So, you know, do you have anything on the table that you're working on right now, or is this still so fluid that this is where you're having this input?
Well, it's a really good question. And I think that's so respectful as a comment of, yes, everybody's business is really essential to them. It's essential to our community, right? I mean, our small businesses in our city are so, I mean, we are so lucky to have so many great businesses in our community. So I absolutely do not provide any recommendations. I don't do that lightly. And but when we think about essential versus non-essential, you know, you think about, you know, really that, what are those things that are really like grocery stores, pharmacies, things that are related to healthcare, things that people are going to need for life, and being able to just, or gas stations so that our healthcare workers can get to work. Even being able to have daycares, certain daycares open because our healthcare workers need those daycares. Our first responders need those daycare options so that we can have them be able to be on the job and working. Those are the kinds of essential things in a time of when we really have to hunker down as a community and say, where's our kind of ranking of value? And protecting life and reducing disease is the #1 value in the EOC. And so, about number 3, I think, is economic. But it's important. It's one of the things we value. Business disruption is right in there too, as one of the things that we hold as a priority. But preserving life and reducing disease in our community is our #1 aim right now. So I don't know if that helps you, but.
Yeah, it does.
Mr. Chair, I'd like to follow up on a comment that Mr. Councilor Neisert had made.
Okay,
and I'll try to be a little clearer.
Let me let him finish, and then you can jump right in, okay? Go ahead and finish.
Oh, I'm sorry. I thought he was. Sorry.
No, you're next. Thank you.
Do you have a thought of what metric would tell you when we start this, when we're done, when you would say it's time to lift it?
That, I would think, that's why we have the health systems in our EOC and Unified Command, because I would want them to be weighing in very carefully with us as to when they feel like they have been able to manage the demand with the capacity that they have. It's going to be very carefully looking at bed availability. It's going to be looking at workforce availability, where they're at in their rate of staff being out because of either COVID or some other illness. It's looking at when we feel like our EMS system is at a point when they can handle any kind of getting back to normal business operations as a city. Those are the kinds of things we'd probably want to look at, but I'm just personally struggling with whether you make it you have to figure out the end date versus you make it for a defined period of time, knowing that if we miraculously, as a community in 2 weeks, said, oh my gosh, we've done such a fantastic job. We're going to be in the front of all the journals in the world because we beat this issue. Then we come back, and you ask us to come back perhaps, and we end it sooner, or you decide to end it sooner without us. You know what I'm saying? But I think I would prefer it have a defined period of time like we've seen some of the other communities and states do, than we have to figure out what that end date looks like. Does that make sense? So.
Okay, you're good. Councilor Kiley, go ahead.
Yes, thank you. I just wanted to clarify that in my earlier statement, I did not state that the medical professionals have stated we're going to do this. My comment was when, and I suspect that there probably will be a time when that recommendation. It has not happened yet, and I did not say that they have made that recommendation at this time, but when it does, I'm likely to support them. It's been illustrated. I mean, it's one of the few best practices that's out there and available to us now. And I think Dr. Elliott, mentioned it very eloquently, stated it very eloquently when he, and I'm just going to paraphrase, basically said that at the beginning of a pandemic, we're often accused of overreacting to the situation. Once the pandemic has passed, then we're accused of not doing enough. So when it comes to protecting human life, I do believe that, in difficult times, we have to make difficult decisions. And believe me, this is an extremely, extremely difficult decision. That's it.
Thank you, Councilor. Anybody else? Councilor Erickson.
Jill, if you could, I know there's been so much all over the board as far as the state level, and I don't want you to speak on their behalf by any means, but remind me what they have issued as far as their, it's state of emergency, correct? Or what did they issue?
Sandy, can you help me out? They have not issued a public health emergency.
That's my point.
They have not yet.
Right, and I know that's two very different things. So my question is what state of emergency are we in considered for the state? Because the health state of emergency gives very different guidelines.
Yeah, and let me get to the beginning of the,
I think I said my point. So
Okay, okay.
I mean, I think it's a state of emergency versus the health state of emergency, which is, it triggers many different laws, it triggers many different functions of state government, and it triggers many additional powers, we'll say.
Yes, correct.
Okay, anybody else? Councilor Neitzer.
First of all, I appreciate Councilor Kiley's clarification. So helping me again, and I think the massage question actually was it's a really good one, because you have something that by its nature is generally, it's close contact, but you're talking about one-on-one contact, so something like that, and there are some medical needs. I mean, it's not just relaxation, and so there's all of these edge cases where people, you know, and so could you address maybe that, or for example, if I'm a tax accountant and I have just a little business and I have run it and one person comes in at a time, when we reach that stage, are we even trying to limit individual one-on-one contacts of strangers, or is that okay?
We haven't written the ordinance yet. We're working on something that we could be ready to bring to you, first to the Board of Health as a recommendation, but nothing's been absolutely written yet. And I would say you want to aim for what is your biggest opportunity to reduce to improve social distancing and increase social distancing. And that was where, when we started thinking about what those or looking at what other communities are recommending, it was really looking at where you can get the biggest opportunity to reduce social gatherings and increase social distancing.
The bars, the restaurants where people tend to congregate. So I'm just thinking of these other cases where you have all these small businesses where you have one person trickling in. And so again, it's going to be about the definitions. And okay, thank you. It's been helpful.
And if I may just add to that, at USF where I teach, I mean, we are strictly prohibited on meeting one-on-one with a student. So that's another approach that they're saying they think that would be probable opportunity for the disease to pass. They're taking that kind of a precaution. So that's going to be, we don't know yet how this is going to look. And I also think, unfortunately, as this thing progresses in our community, our discussion is going to change here. Because right now we're talking about probabilities here, scenarios, right? And so if we do get hit with a high number, everything could change.
Yeah, I think,
Go ahead.
was there more?
Nope, you go first. You're fine.
Go ahead.
The only thing that I will add, and I know I've kind of said it before, as we do see that, and I've talked about the scale of, 0 to 100, if we can somehow do the 10 threshold and allow businesses to operate and still pay their lights, I'm not saying never will we have to do 100%. I think I hope that time doesn't come. But when that time comes, we have to be able to act quickly and have that written so it can be done and quick should we get to that point. But being able to time it is key, and keeping that 10 threshold, I think, still lets people pay their bills. I'll just hammer that home a little bit.
Yeah, I think all I was going to add is, again, I'm kind of summarizing where, again, when I'm batting cleanup here, I'm hitting a lot of points that have been hit and that have been really good ones. But I think what the word of the day might be balance, where again, is it 0 to 100? Is there something in between? Are we choosing between left and right? I mean, there are no easy answers here. I mean, it's just none of us have seen anything like this or been faced with it before. It's a moving target where today we might be thinking, well, I don't think I'm going that way. And then data, again, the other big word, in 24 hours to 48 hours is going to change. We're going to go, yeah, okay. So, I mean, it's just, I appreciate what we're all juggling here. The one thing I'd throw out to all of us as city leaders is that non-essential businesses title has really kind of always bugged me a bit. We're all throwing it out, and nobody means it intentionally, but I always kind of think that's a little bit of salt in the wound to the small business owner right there who's 2 to 50 employees, and he's being called, you know, non-essential, again, not intentionally, but on top of everything else that he's facing, we're putting him in that category. So I don't know if we've got a better term or if that would even help, but I just, every time I hear that, I just kind of cringe a little bit. So whoever's out there listening, the small business owners, I'm sure nobody's doing it intentionally. So anyways, good talk for today. Thanks for being here. I think we'll move on to the public input portion of the program. If anybody wants to comment on today's subject, come on up.
Sierra Broussard, Sioux Falls. So we're not here to lobby. Mayor Tin Higgins said that to somebody here in the first meeting. I don't want to upset the mayor, but I'm going to say this. We're all about business owners, correct? Small business. Downtown, the Burger King, all these restaurants are doing, they're closing down, they're using the drive-thrus, they're doing everything the executive order is saying to do except for a small amount of people. Come up with a plan to hold those people accountable. I understand that maybe some of these business owners are rich, and if y'all put, say, if y'all don't do this, then the city's gonna fine you $200-300. That's easy for them to pick up and do it, to pick up that $200-300. But if they keep getting fined and fined and fined, and eventually they're gonna learn 10 or less people here, I don't think shutting down all of the businesses, Governor Nome is not about shutting down the whole state. I called Pierre today. The health department is letting the massage people work. In Pierre, they said, follow the protocols of the executive order and CDC. Now, it says in the paper and all on social media that the mayor is gonna come and want to close down all these small businesses and all these venues and that. Do I agree with the mayor? Absolutely not. Do I agree that we have a little bit of bumps in the road that people is not taking what he says seriously in the executive order? Absolutely, yes. I disagree with these doctors here. The case that we had of a death that happened here in South Dakota was not just from the coronavirus. This patient probably had some kind of underlying illness that the coronavirus just topped this patient off of their life. Do we actually know if you're gonna get the coronavirus and you're healthy, is it gonna automatically kill you? We don't know. We're gonna have a little bit of spread in the community. This is not a chemical warfare that it's gonna kill everybody. It's not like that here. I think we should go step by step, day-to-day basis. But jumping the gun and closing down all of these small businesses and 800 and something massage therapists that we're facing here, it's not gonna help the situation. Use your protocols, use your executive order, use your CDC guidelines for now, and be done with this. Let's try to hold these businesses accountable that is not listening to the executive order, make some kind of law, city ordinance or something to ticket them, to make an arrest, to do something within city government, or maybe Pierre can do something on a state statute saying if you don't abide, you can get a class 1 or class 2 misdemeanor, whatever, to hold them accountable. Everybody is doing what they're supposed to do in the city except only a small few businesses. And I'm not gonna mention the small few businesses, but there are just a handful of businesses that are doing this. Guys, I don't wanna be hard. I don't wanna throw the ball at and say that the health department's wrong on this, and I don't want to be heartless or cold-hearted here, but this is a new virus, and we just have to let it run its course here. We have the flu that kills a lot of people this year, killed a lot of people. The flu did. And what about the bird flu? So I just think that this has been taken out of proportion here. We're not in a third war here. We're not in World War III. We're not in chemical warfare. A bomb didn't drop on us and we got to hide because the chemicals are going to kill us all. So I think that we practice keeping small businesses alive. Let's do what we can to keep them in business, to keep their bills getting paid. And I think that's what we should do. So coming forward tomorrow, when the mayor's going to come with these shut down the businesses, I hope that council votes it down. Thank you so much.
Bruce Danielson. Saturday and Sunday, especially Saturday, I got to witness something I hadn't really thought much about. When Councilor Pat Starr and I did a absentee ballot drive up and drive through session over at the Frying Pan on the east side. And I hadn't thought about how many people were going there for a warm meal because they couldn't cook it at home, or they didn't have a place where they could cook it. And that became the restaurant where they could go and get something. And made me start thinking as I been driving around town the last couple of days since, and how many restaurants have actually closed down in this town, and the people that normally would go and get something to eat at those restaurants, even if it was to carry out, can't get their usual meals, and they're struggling. And we have a lot of pockets in this town where there isn't any food available, and no restaurants, not even fast food and it's getting to be an issue with some individuals. I have been working with customers around town the last couple of days also. Small businesses, 10, 20 people. One business has about 100 people. And I've been amazed at the care that they're taking in preparing for anything that would hit their business, virus-wise. When I hear the expression non-essential business, it makes me start wondering, our restaurants, the financial institutions, the service businesses that are operating in this town that keep the trucks on the road, that keep the billing done that's necessary. Are we going to be trying to force all of these people to shut down, which then shuts down the trucking industry or the airline industry from being able to function as we need here? The delivery fields that need to, delivery vehicles that need to bring the drugs and et cetera into town. How are we going to classify non-essential? The drive-through thing also pointed out something else that was incredibly important, is that the people want to be able to continue to vote. There was some shenanigans that were played this weekend while we were out doing our absentee ballot drive-through that I won't go into all the details of it, but I found it very disheartening that members of this council would play games with our vote. Our votes aren't to be played with. No matter what you want to do, sending information up to Brookings, up to a partisan hack operation, and we end up getting our vote compromised. That's not proper. That's not correct. It should never be done. Sending messages, even from this floor, when you're sitting at the dais, and you're smirking at me right now as I'm talking to you, because our votes are not your property. Our votes are our property. And we're tired of these games that are being played trying to circumvent what's going on. We have secret slush funds of massive amounts of money that are sitting in bank accounts ready to corrupt the vote. And
Are we talking
as we
about
get
the
down
virus?
to this, I have 58 seconds left,
Let's
and
keep
I'm
it on
going
the
to be
subject.
finishing up shortly. That we don't need our votes played with in the corrupt way that it was done this weekend. And you can shake your head, and you can smirk, and you can sit there and play with your hand sanitizers and everything else, but we're going to do something about correcting this process, and that's it. Thank you.
Anybody else? Come on up. Welcome.
Thank you. I'm Don Rose from Shenanigans Pub here in Sioux Falls. You guys are agonizing over something that's really tough for all of you. Jill, the mayor's office, I heard him this morning. You know what, guys? Lots of places have already closed down trying to tell you it's not the end of the world. It's really not. And maybe some people are trying to tell you, but don't agonize over this. I know Christine not very well, but I know her the best of all of you here in the room. She's got kids that run all over the neighborhood. If one of them died, she'd be really mad at herself for not closing down the restaurants and places she needs to do that. Don't agonize over this. Let's make sure we make this all safe. I've sat here quiet for 4 hours and not trying to say anything, but it bothers me when we think that through there, that we as a group, everybody in this room, knows the same thing. They don't want anybody to die. They've already got a legislator from Sioux Falls in the hospital here. I've known him for years. He's not a good friend of mine, but I've known him for years. He doesn't want to die. His family doesn't want him to die. If we can close my restaurant for a couple of weeks, I'll be fine, and so will a lot of other people.
Thank you. Anybody else? All right. With that, we will adjourn. Thank you.